bleeding gums, and the 3 simple steps to prevent it. According to new studies, poor oral hygiene, including bleeding gums, can increase your risk of cancer and other health problems. How can you stop this health problem? Welcome to the channel. I hope that you are well. Before you think that bleeding gums is a mild condition, please give me a few minutes. Here are some reasons to take action if your gums bleed, and the 3 steps to take now to stop bleeding gums. Bleeding gums is the number 1 cause of tooth loss to extraction, pulling the teeth off. We know how that feels like, or we can imagine it, if you have been blessed to have all your teeth intact. A fun fact: untreated gingivitis, bleeding gums, left without any care can, and does worsen, to the extent that the affected teeth need to be removed, tooth extraction, to stop the pain and prevent the infection spreading to other teeth and organs, like bacteria entering your blood circulation, and leading to septicemia. Septicemia is blood poisoning. This happens when your immune system overreacts to an infection, in this case, untreated gum infection, and starts to damage your body's own tissues and organs. So, is this normal for your gums to bleed? Bleeding gum is a very common health condition. You may know this, especially if you have ever had it. Since it is so prevalent, it's no wonder some people believe that it's nothing to worry about. So, you are not alone if you have this view. Most people think that bleeding gum is normal. I used to think so myself. A whopping 90% of adults over 30 experience it. So most people think it's normal. You are brushing or flossing your teeth and your gum bleed. You may think, this is annoying, and think no further about it. Are you beginning to think bleeding gum is not harmless yet? When your gums bleed when you brush or floss, this is the major warning sign that the bad bugs that cause gum disease have gained direct access to your blood system. Not just that. These nasty, little bugs can, and do enter into your whole body system and lead to more health complications. Listen to your bleeding gum telling you something worth taking fast action about. A health condition is underway. Not an inconvenience. The gum line, where the initial battle starts. During an infection, our body's alarm system is triggered. The immune system causes an inflammatory cascade in the affected area. The above action isolates the infection, and also increases the immune system's ability to provide backup with white blood cells and other immune system defenders. However, in the case of gum disease and the associated bugs, their enemy base camp is located in hard-to-reach areas. This is outside the reach of the immune system. The bacteria colonize inside the gum pockets. These are the spaces between the root of our teeth and the gum tissue that surrounds each tooth. Bleeding gums is a major warning sign from your body that your immune system is under heavy attack. Not just your mouth. How do you know if you're experiencing bleeding gums? 9 out of 10 adults over the age of 30 have gum disease. Long before we see any signs, the bad bugs colonize the gum pockets, the junction between our teeth and gums. People often fail to deal with it at the initial sign of gum redness and bleeding before more damage is done. Here are some signs of oral health disease most people have experienced. Red, swollen gums. Bleeding gum when brushing or flossing under normal conditions. Some blood on your toothbrush or floss after brushing or flossing, familiar. Let's be blunt. If you are experiencing the signs above, you most likely have a developing case of active gum disease, also called gingivitis at this stage, meaning the gum disease has started. What is the mission of these bad bugs or bacteria? Their mission is to invade, colonize, and eat the gum and bone tissue in your mouth. No less. And, wait for it. They also contribute to the development of other diseases including diabetes, heart disease, and cancer. It's more than bad breath and rotten teeth. Can bad oral hygiene affect your health and well-being and increase your chance of developing cancer? According to a research, people whose teeth and gums are in a poor condition may be more prone to a certain virus that can cause certain mouth and throat cancers. Research suggests that the bacteria that cause periodontitis, a disease affecting the tissue surrounding the teeth, may also play a part in the onset of pancreatic cancer. Again, in another study, published in the International Journal of Cancer, it was demonstrated that periodontitis has a clear link to cancer mortality. An especially strong link to mortality caused by pancreatic cancer was found. 70,000 Finns participated in this 10-year follow-up study. According to study author Timo Sosa, a professor at the University of Helsinki, these studies have demonstrated for the first time that the virulence factors of the central pathogenic bacteria underlying gum disease are able to spread from the mouth to other parts of the body, most likely in conjunction with the bacteria, and take part in central mechanisms of tissue destruction related to cancer. Bleeding gums affect the health of our teeth, leading to receding gum, that is when the margin of gum tissue around the teeth is wearing away, toothache, and the dreaded visits to the dentist's chair. 3 simple steps to prevent bleeding gums and reduce the risks of the associated health conditions. 1. Go for regular dental checkups, as advised by your dentist. In the UK, 1/3 of the dentists have gone private. So, people without private dental insurance are feeling the pinch. 2. Upgrade your own oral hygiene tools. Replace your brush every 3 to 4 months, or whenever the bristles, the brushing surface, is no longer stiff or standing straight. 3. Brush at least twice daily, the right way. Having worked as a dental therapist, I have seen quite a lot of people don't use the right brushing technique. Please, learn to brush the right way. Number 4 way to prevent tooth diseases is by flossing. Floss at least every other day, using the right technique. Floss can get into the spaces that a regular brush cannot get to. Other teeth and gums conditions to watch out for. Check out these other oral health conditions. Consider getting some help if you suffer from any of them. Red, puffy, swollen area between 2 teeth. Gum bleeding a bit when flossing or brushing, this is gingivitis. Bad breath that never seems to go away, even after brushing, called halitosis. You experience pain when your teeth are exposed to hot, cold or sweet food or drink, also called tooth sensitivity. Your teeth seem to be getting longer due to gum recession, when the gum wears off. When you get chronic canker sores on the gum. Teeth shifting or feeling loose. Or, when you get painful abscessed teeth and pus, in sores along the gum line. Perhaps, one good question to ask is, are my current oral hygiene products working well for me? You know, if toothpaste worked to stop gum disease, 9 out of 10 adults would not get gum infection now, would they? The good news is that it is possible to be free from the damage of gum disease. That is by going for regular dental check (UPS), as advised by your dentist or dental therapist or hygienist, by upgrading your oral hygiene tools, brushing at least twice daily, the right way, and flossing at least every other day, using the right technique. Thanks for listening. Have a great week. Don't forget to get in touch with your questions and suggestions. Found this post helpful? Please help someone you care for, share this video, subscribe and leave comments below.